During this video, we'll explain what's involved in a breast reconstruction. This is a cosmetic procedure to give you a breast shape after mastectomy has removed your original breast. Some women require this treatment for both breasts. A surgeon will recommend the precise type of reconstruction technique depending on the amount of tissue they need to transfer, its blood supply, and your personal preference. While you're still awake, the surgeon may draw guidelines on your skin. This is to guide them during the surgery. There are different types of anesthesia for this procedure. The final choice will depend on your personal requirements and the surgeon's recommendation. It's usually done under general anesthesia. Full personalized details will be included in the written consent information. The surgeon will start by making a cut or incision. The exact length and location will vary depending upon your personal requirements. The technique, which is planned for your case, is an abdominal flap technique. This involves taking skin, fat, and muscle from the abdomen and transferring it to the chest. The exact technique will be finally determined once the surgeon has examined the tissue and the blood vessels that feed it. One way of doing this is to keep the blood vessels attached and tunnel the tissue under the skin to the chest. If this is not possible, then the tissue is detached from the blood vessels and reconnected to blood vessels in the chest. An artery and vein will need to be carefully stitched using microsurgery to reestablish blood flow. If there is muscle weakness in the abdomen, this may require strengthening with sutures or a mesh. The surgeon may leave drains in the wounds to remove any excess fluid. This is usually removed within a day or two. Finally, the skin will be closed with sutures. Dressings will be applied. There will be some bruising and swelling in the first few weeks. However, this will settle over time. The scars will heal over months and years to become faded lines. However, it's important to note that there will always be visible scars. You may be fitted with a compression garment or bra to support your breasts while they heal. The new breast mound normally feels numb, and skin sensation to light touch does not normally return. In time, once you've fully healed, you'll notice the long-term contours of your new breast mound. The next stage will be to create a nipple and areola. This can be done in various ways, including tattoos or a further surgery to take the skin from the breast or elsewhere in the body to form a nipple shape. Areola pigmentation can also be achieved using a tattoo. You may even consider surgery to the other breast to make them as symmetrical and natural looking as possible. Depending on how much tissue is moved, you may also require a synthetic implant to increase the size of the breast contour. This is usually decided before the start of surgery. In time, once you've fully healed, you'll notice your new breast contours. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.